Okay, my name is Heather, and I will be doing my physical assessment on my volunteer patient, Ashley. So are you okay to do the physical assessment with me today?
Yes, ma'am.
And I went ahead and washed my hands before the exam, so my hands are clean. So we're going to do a head-to-toe assessment, and we're going to start by inspecting your skin, your general appearance, checking everything out, skin color. I will inspect your skin as I go through each system of your body, so we won't look at all of it right now. Typically, she would be in a gown for this, but since we're doing this at home, we don't have a gown, so she will be in her regular clothing. So I'm going to start with your scalp. I'm going to inspect your scalp. I'm going to inspect your hair. I'm going to palpate your cranium, look for any lesions, any tenderness. I would look at the whole entire scalp, looking for dryness, any lesions on your scalp, or anything out of the ordinary. None of that will be noted today. And then we're going to move on to your face. So what I'm going to have you do is I'm going to have you wrinkle your forehead for me. And then I'm going to have you close your eyes for me. I'm going to try to pry them open. Go ahead and puff out your cheeks for me. And then I'm going to have you clench your teeth for me. Perfect. So now we're going to palpate your temporal artery, which is right here in front of your ear. We felt on both sides. And then we're going to palpate your temporal mandibular joint. So what I'm going to do is palpate here. I'm going to have you open your jaw for me and close it, and then move it from side to side. And it moves freely without any problems. And then clench your teeth one more time, and I'm going to try to bring them apart. Very good. And then now I'm going to palpate your sinuses, the maxillary sinus. Let me know if you have any tenderness there. Okay. So now we're going to check your eyes. When we did your vital signs, your height and your weight at the beginning of the exam, we would have gone ahead and done the Snellen eye chart at that time and checked your vision from 20 feet away. We would have had you cover your left eye, your right eye, and then do it with both eyes uncovered to see what you could see from 20 feet away. And now that we've done that, we're going to check your visual field or confrontation. So I'm going to have you look straight ahead at my nose, and I'm going to hold my hands out in your periphery, and I'm going to wiggle fingers on one hand, and you let me know which hand.
Left.
Okay.
Right.
Perfect. And now we're going to check your 6 extraocular eye muscles. So what I'm going to have you do is look with your eyes right at my finger, and I'm going to have you follow my finger with your eyes only, not moving your head. So go ahead and follow my finger. Okay. And so now we're going to inspect the structures of your eye. We're going to look at your sclera, the conjunctiva, the iris. We would also look at this with an ophthalmoscope, but we don't have one of those available today. And now we're going to grab our pen light, and we're going to check your corneal light reflex. So when I shine the light in front of you, I can see the light reflecting equally off both of your corneas. And then we're going to check your pupils, make sure that they're equally round and reactive to light. So I'm going to shine the light in both of your pupils while you stare straight ahead. So go ahead and look. I'm checking to see that each time I shine it in, your pupils do constrict, and they constrict equally in both eyes no matter which eye I shine the light in. And now we're going to check accommodation. So what I'm going to have you do is stare at my pen light up close, and then when I tell you, I'm going to have you look off far away, and we're going to look at how your pupils react. Okay, now go ahead and stare off to the distance. And again, we can see your pupils adapt to that. And now that we've done that, we can move on to your ears. So we're going to inspect the structure of your ears. We're going to make sure that they're symmetric and that there's no lesions or anything abnormal there. We're going to palpate your auricle for any tenderness. And then we're also going to palpate your tragus. We would have already performed the whisper test, which you would have passed bilaterally from 5 feet away. I would have whispered a word, and you would be able to repeat it back to me. Now we're going to move on to your nose, and we're going to check first, inspect, and make sure that it is symmetric and proportioned with your face. And then we're going to check the patency of your nostrils. So I'm going to have you close one nostril and inhale in for me. Perfect. And then repeat with the other nostril. Okay. And now we're going to move on to your mouth. So I'm going to use my pen light again. I'm just going to look inside your mouth. I'm going to check your dentition, your buccal mucosa, your gums, your tongue, your soft palate, and look inside. So go ahead and open up for me. And everything looks good there. Your teeth are in good repair. And then I'm going to have you say ah. I'm going to check your uvula. Make sure that it's midline perfect. I can see your tonsils and that your soft palate rises. At that point, I would have also checked your gag reflex by extending my tongue depressor down into your mouth, but we don't have to do that for this exam. So now I'm going to have you do is stick your tongue out of your mouth for me. We're going to check that it's midline and there's no tremors with that. Perfect. All right, so now that we're done with your mouth and your throat, we are going to check your neck. So we're going to check and make sure that your neck is symmetric, there's no pulsations, and that there is no notable masses. And then we're going to palpate your lymph nodes. So we're going to just start, feel those. and none are felt. And then we're going to palpate your carotid pulse. We're going to do one side at a time, and that way we don't cause you to pass out. And then we're going to use our stethoscope, and we're going to listen over the carotid area. We're listening for bruits, which would be a swishing sound. Okay, perfect. So now we're going to palpate your trachea. We're going to make sure that it's midline and there's no leak or no nodules there, and it feels great. And then we're going to check the range of motion of your neck. So I'm going to have you bend your head forward and then backward for me. And then I'm going to have you bend with your ears to your shoulder. And then turn your cheeks from side to side. And then we're now going to check also the muscle strength of that. So I'm going to have you bend forward against my hand and backward against my hand. Turn your cheek to this hand and then to this hand. And go ahead and shrug your shoulders for me. Okay. So now we're going to move on and palpate your thyroid. So I'm going to have you just turn this way a little so I can get from behind you. I'm going to feel for your thyroid, and then when I tell you, I'm going to have you swallow. So, all right, go ahead and swallow. And I can feel the thyroid move, and there's no nodules there. And while I have you in this position, I'm going to inspect your posterior thorax. So I'm going to check out first your skin, make sure there's no lesions or anything abnormal here, no rash. I'm also checking your muscles, making sure everything is symmetric and your shoulders are symmetric. And then I'm going to go ahead and listen to your lungs. So, we're actually going to palpate your spinous processes and make sure that your spine is aligned, which it is. So now we're going to listen to your lungs. Okay, and then the one thing I didn't do was check the costovertebral angle. I'm going to palpate that and see if there's any tenderness. And that would be checking out your kidneys. Alright, so now you can face back towards me, and we're going to listen to your lungs from the front. Again, I would inspect the skin here, and I'm going to watch for respirations and see that those are even and unlabored. And we're going to listen to your lungs again. And now we're going to listen to the base of your heart. So I'm going to have you lean a little bit forward for me, and then I'm going to have you exhale. Okay. So now what we're going to do is check your upper extremities. So we're going to start with your hands. I'm going to look at your hands. I'm going to look at your skin. I'm going to check your nail beds, like everything's symmetrical, the contour of your nails. And then we're going to palpate all the joints in your hands and your wrist. Any tenderness there? And we're going to feel the temperature of your hand and check your skin turgor. Making sure your hands are warm and dry, that they're not cool or clammy. Once we've done that, we are going to palpate your pulses. So we're going to start with your radial pulses. I'm going to palpate both sides at the same time so I can compare them. And then moving on to the brachial. And then we're going to palpate the epitrochlear lymph nodes on both sides. Okay, so now we're going to check range of motion of your shoulders. So I'm going to have you move your arms up and behind your head, down and behind your back, and roll your shoulders forward for me. Roll them back, bring your arms up, back down, Put your arms out in front of you, fold them over, roll them back. And now we're going to check the muscle strength in your arms. So we're going to have you put your arms up like this, and then bring them up a little higher, and then resist against me, and then now bring them down, and push down against me. Perfect. Okay, and then we're going to do your wrists, range of motion of your wrists. So we're going to have you bend your hands down, bend them up, spread your fingers, bring them back, make a fist, and then put your thumb to your pinky, base of your pinky. Very good. And then we're going to do the bilateral hand grip. So I'm going to have you cross your arms and then grab my fingers and tug. Okay. And now that we've done that part, we are going to move on. We have you lay down, and we're going to look at the jugular veins in your neck, the jugular venous pulse. So go ahead and lay flat for me. You can still see. So to do this part, I'm going to have you lay flat, and then if you can tolerate that, then I'm going to have you look away from me. I'm looking for the pulsation in your neck where your jugular vein is. And then I'm going to check your your precordium area. So to do that, first I would inspect the area, making sure there's no abnormal pulsations or any lesions or anything, abnormal in this area. Then we're going to palpate the anterior chest, feeling for any thrills, any abnormal heaves. Any tenderness here?
No.
Okay. So I can feel the point of maximum impulse here, which would be the base of the apex of your heart. So I'm going to go ahead and take a listen there and count your pulse. I'm going to count for 15 seconds. Alright, so for 15 seconds there were 20 beats. If you did that 4 times, your pulse would be 80 beats per minute. And now I'm going to listen to your heart at all 4 of your valves. I'm going to do it twice, once with the diaphragm and once with the bell. So the first I'm going to be listening for the normal heart sounds, and I'm also going to be listening for murmurs. So. And then if you don't mind, I'm going to have you lean a little bit to your left side, and we're going to listen to the apex of your heart. Okay, so now you can roll back on your back. While your knees are bent, that relaxes your abdomen. We're going to do the abdominal exam. So we're going to start with inspection. We're going to look at your abdomen, make sure of the contour, that it's symmetric, there's no abnormal pulsations. We look especially over the area of the umbilicus. And then once we have inspected the abdomen, we'll move on to auscultation. We're going to listen to all 4 quadrants to your bowel sounds. So we're going to start in the right lower quadrant and move around. And after listening to your abdomen, we will then percuss it. We're going to do 3 times in each quadrant in a zigzag pattern. And then we're going to palpate your abdomen. And so let me know if there's any tenderness here. Okay. So now I'm going to have you straighten your legs and we're going to check the range of motion of your hip for me. So what I'm going to have you do is flex your hip joint, which means I'm going to have you bring this leg straight up in the air for me. And then you can bring it back down. We're also going to check the abduction and adduction. So I'm going to have you move your leg away from your body and then back into your body. And then we're going to check internal and external rotation of that joint. So I'm going to have you bend your knee for me. And we're going to roll it out and roll it back in. And now we're going to check your muscle strength. So lift up your leg against my hands and then push out against my hands. And we would do this on both legs. And while I have you in this position, we're going to move on to your lower extremities. So I'm going to begin by checking the symmetry of your legs. I'm going to check your skin color, making sure that your hair grows, it's evenly distributed, looking for any noticeable edema. I'm going to come down and check your feet out. Let's see. There we go. So while I am down here, I'm going to be able to palpate your dorsal pedalis pulses, your posterior tibial pulses, and then I'll be able to go behind the knees and feel the popliteal pulses. And then I'm going to palpate and make sure that there's no edema here. So now we're going to check the range of motion of your ankles. What we're going to have you do is I'm going to have you hold your feet. It's called dorsiflexion. Bring it up and then point them and bring it down. And then I'm going to have you curl your toes and straighten them out. And then I'm going to check the resistance of your feet. So I'm going to have you push against my hands and then bring up against my hands. Okay, and now we're going to check your cerebellar function. So I'm going to have you take this foot and run your heel down your shin. Perfect. And then you can do the other one as well. Okay, so that's that. And then we will grab our tool and we're going to check your Babinski reflex. This is something that happens in babies and it should be gone by this time in your life, but if you had it, that would be an abnormal neurological finding. So I'm going to run this object. It would typically be the bottom of my reflex hammer. Okay, so now that's negative. If it were positive, your toes would have splayed outward. And then I'm going to have you sit up and dangle your legs over the edge of the bed. And then we're going to check the range of motion of your knees. So what I'm going to have you do is I'm going to have you extend your leg out and then flex it back. And then we're going to do it again with resistance. So push against my hand, you can do both legs. And then back against, very good. And now I would check your reflexes. I would use a reflex hammer, which I don't have. So we will use the bell of my stethoscope. So just relax your legs here. And then we're going to feel for your patella. So just below it. And check the reflex of your knees. Perfect. And now we're going to get to do stereogenesis. So I'm going to put a familiar object in your hand, and I'm going to have you identify it while you have your eyes closed. So you can go ahead and close your eyes. I'm going to grab my familiar object, and I'm going to put it in your hand. And if you can feel that, and tell me what it is.
A coin.
Perfect. Okay. And now we are going to check light sensation on your face. So what I'm going to have you do is close your eyes. I'm going to touch your face with something soft, and you tell me what part of your face I'm touching.
My cheek. Chin.
Okay, perfect. And now we are going to check, well, we would check superficial pain. I would poke you with something dull or something sharp, and you would let me know which one it was, but we don't have to do that for this exam. So now we're going to check position sense, which I'm going to have you close your eyes again. I'm going to take one of your fingers. I'm either going to move it up or down, and you're going to let me know which way I move it. So I'm going to take this hand, your middle finger, and then you let me know which way it's moving.
Down.
Okay.
Up. Down.
Perfect. Okay. And then the last thing I'm going to have you do is open your eyes. We're going to check rapid alternating movements of your hands. So I'm going to have you take your thumb and touch it to each one of your fingers, and you're going to do it rapidly and alternate them. Okay. That's perfect. So now for the last part of the exam, I'm going to have you, we're going to have you stand up and walk. So if you can stand up and walk to the edge of the room for me. And then you can turn around and walk back. This time, heel to toe. Perfect. If you want to turn back around and take a few steps on your toes. And then you can walk a few steps on your heels. Perfect. And then we're going to have you stand right here for just a moment. We're going to have you check what's called the Romberg sign. So your feet are going to be together. We're going to put your hands by your side, and then I'm going to have you close your eyes. I'll be right here in case you feel like you're going to fall. But I'm going to check for 20 seconds if there's any abnormal swing. So go ahead and close your eyes for me. Okay, perfect. And now we're going to check the range of motion of your spine. So what I'm going to have you do is bend forward for me. Perfect. And you can stand back up. And I'm going to have you bend side to side. And then I'm going to have you twist side to side. All right. And then the last test that we're going to do for the exam is a shallow knee bend. So I'm going to have you hold on to our exam table. And then once it's off the ground, I'm going to have you bend one knee, just a shallow bend, and then alternate. Perfect. And that is it for my head to toe physical assessment. So thanks for being a wonderful patient.